Welcome, viewers. India is passing through a brutal second wave of COVID-19. The entire healthcare system is overwhelmed. It seems to be the crisis of the century. But in this hour of crisis, the global community has led a hand. We have a very special guest joining us today, Her Excellency Ritva Koukku Ronde, the Ambassador of Finland to India. Welcome, Your Excellency, to this very special broadcast. My first question will be, how is Finland helping India in this crisis?
Our sympathies and solidarities are with the people of India with this fight against the destructive second wave of COVID-19 pandemic. Finland, together with the European Union partners, have responded to India's call for emergency aid. And this is really our joint effort at the moment. Finland provided India with material assistance such as oxygen cylinders and pulse oximeters via the EU civil protection mechanism. And actually this shipment came yesterday night. In addition, Finland supports India through the Finnish Red Cross with €1 million to fight the pandemic.
Excellency, as you know that in last year, US and European Union and all the countries, they had faced this problem. So if you could tell the viewers that during those pandemic times, how Finland tackled this COVID and what were the strategies?
Back in spring 2020, the Finnish government reacted actually very swiftly and imposed a wide scope of restrictions and using for the first time actually after the Second World War emergency law. For instance, schools and other institutions, restaurants, concert halls, etc., they were closed. There were restrictions on travels. There were strong recommendations for elderly people to stay at home. You couldn't visit people at elderly homes, for instance, etc., etc. Even there was some ban on Helsinki surroundings for travel for a couple of weeks. And of course, we have had the international travel restrictions as well. At the same time, also the government was introducing a very comprehensive support package for the business and individuals from the economic slowdown resulting from the virus, and that was also helping the SMEs very strongly at that time. And of course, additionally, the European Union was planning the 750 billion recovery package for green recovery at that time. And many companies at that time also, they swiftly ramped up the production of different equipment, such as respirators, for instance. Several private companies also retooled to produce products for the healthcare sector or consumer market on their own initiative. And then, of course, remote work was also introduced very, very quickly, and it has become a new normal. Actually, we haven't yet returned to that. We are still working very strongly remote, and that will be after COVID even our sort of new normal. There was one thing actually in the Finnish society which we have, and that is trust. And that is trust to the government decisions as well. And that was played a really significant role at that time because people were really obeying these restrictions. We didn't have that much restrictions, although of course during the months people were getting a little bit impatient, and when things went a little bit better last year, of course the restrictions were also eased at the time. We used also this lockdown, or actually it wasn't lockdown as such, but the really severe restrictions. We used also up to sort of scaling up our capacity for testing or contact tracing. There continued to be various things. We had a good app, which were a tracing app, for instance, which was loaded immediately in considerable amount. And then nowadays, then we are more or less looking more on focus on regional restrictions, and that is up to the regions, and it is depending very much on the severity of the COVID-19 situation. So, in some areas, we have now starting again to ease the restrictions we implemented a couple of months ago, and in some areas there are more severe restrictions. But Finland is easing now restrictions considerably actually during this week, during
That's
next week. Sorry. Yeah.
Yeah, that's quite interesting how the Finland has been tackling this crisis. My next question is how are situation now in Finland, and have you started any vaccination program designed to cover the entire population, and do you have any targets in mind?
Actually, the situation in Finland is, although some of the restrictions still what are there, it's pretty good compared to the for instance, European situation in general. We have one of the lowest sort of level of pandemic situation in all fields actually at the moment. Also, the positiveness rate is low. Um, and at the moment, we have had already the vaccination system, which is covering actually, meaning to cover all adult up from 18 years old, and we are now already also starting to think about maybe a little bit adolescents and a little bit younger. But it was starting. It was really starting to. The priority is to immunize the whole population, and that has also, of course, we strongly believe this sort of scientific evaluation and research evidence that the more you vaccine, the better the situation will be in the longer run, and the immunization is helping, of course, the situation also of severe cases. We have had various categories starting in the vaccination program for really urgent healthcare and social welfare workers, and then the second one, those above 70 years old, and then high risk COVID disease cases. We are now in the sort of fourth category already, that we are vaccinating all populations, but that is also going with the sort of 10 years age group, and it varies a little bit. In most of the places it is and regions, it is up to 40 years old or up to 50 years old. So we are having now one of the highest coverage also in Europe. 44% of adults have got already the first dose. But we have used also the idea that we are trying to cover as many as possible with the first dose. So we have relatively low the second dose. It's something like 5% at the moment, but first dose is very good, and more people are getting really vaccinated every day, and we hope that that the country is immunized by late summer this year, and then at the same time we continue also the sort of normal measures like using masks. We have social distances. We are still not really having events with big crowds. Our restaurants are slowly starting to open up, but still also with restrictions of opening times, etc., etc. So we are not at all yet back in normal, or back in the new normal in Finland.
Excellency, what India could do better to overcome this crisis?
I think for India, and like every country, I wouldn't like to specific India, but every country is to try to limit the spread of the virus by continuing to implement strict measures and to continue to inoculation program efficiently and with wide cover all over. And needless to say that this sort of efficient tracing and testing still are necessary tools to combating the pandemic. And then the citizens, I think, also have responsibility everywhere to continue following this sort of normal ways and means like social distancing, wearing masks, washing hands, supporting each other also in this fight. Whatever they can do, actually, in a sense, sort of using common sense still, and not thinking that everything is over. It's not yet over.
Excellency, one more question which comes to my light, where I would like you to throw some thought on this. Do the world community needs to adopt a strategy to combat this epidemic? Should rich nations help other countries in vaccination and think of waivers? Because it has been in media for the last many weeks now.
I would first of all say that, and I forgot from the last, of course, the healthcare systems in general are very essential. We all need to somehow look that our healthcare systems are having enough capacity to have this kind of shocks also. So that is one of the things which we have to think about also in the future. When it comes to the global answer to this pandemic in general, this is a global issue, of course, and of course we need to have global solutions for global problems. We luckily have the World Health Organization, which is a global organization consisting of every country in the world. So WHO is doing a very important work in this. We need to put a lot of attention, more attention than before, for health security issues in general. And there is a lot of things to do in this area, and my government is very strongly supporting about enforcing this sort of common strategies. India has, of course, given valuable support to many countries, donating and exporting vaccines and medical equipment, and we all try to have our own input. And I'm very proud that the European Union is the biggest aid provider at the moment in India, over 100 million euros. But hope very much more, of course, in this sort of pandemic crisis. Global solidarity is very necessary. We are together in this fight, and we really need to support each other.
It seems that the entire globe is sailing under one boat, and we have the global crisis affecting all the countries. So, first of all, I'll thank the Finland for supporting India in this hour of crisis. We are thankful to Finland for providing us all the important medical equipments which have just landed in India. And on this note, I would thank Ambassador of Finland for joining on this very special program. Thank you very much.
Thank you very much for your interest. Thank you.
This is Ameya Sathaye for sarkaritel.com and diplomacyindia.com signing from New Delhi, India. Thank you very much.